Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we will present to you a newer technique for the so-called Alar reduction. Let's all welcome Miss Jean.
Yes.
Welcome.
Welcome po.
Kumusta po?
Okay lang po.
Okay, so Jean here has a concern on the nasal region.
Yes.
Okay, so her concern is the width of the alars, right, Jean?
Opo.
So we wanted to also narrow it in the right
Angle.
size, width,
Yes.
and within the vertical fifth of the face. Okay, so looking at Jean right now, yung tinatawag na vertical fifth of the face between the medial canthi. Yan. Parang intercanthal. Dapat nakapasok doon yung width ng wings of our nose. Di ba tawag nila dito wings of the nose? Ito. Okay? So if you're gonna look at that, yung sa ito, medial canthus ng right and medial canthus ng left. So medyo may konting excess doon sa line na yon, sa vertical line na yon. So somehow, Jean, gusto natin siyang ipasok within. Okay? And dapat proportionate doon sa kanyang full face shape. And also, kailangan harmonious ang result, right? And another thing what we wanted to do also for Jean is somehow also, dito din sa bridge, we'll make it narrower. And also, pagdating dito sa tip, we have to upturn it also para we can see the columella. Okay?
So, parang nakayuko siya, Doc, no, on assessment.
Naka-downturn. And syempre, yung Asian nose, di ba, Jean? Yung rounded nose tayo dito.
Bulbous ba?
Yes. Yun, concern ni Jean, yung rounded nose, bulbous nose, or tip, and also yung wide yung alars niya. Okay pa naman yung nasal bridge, you'll just enhance it. For female nose, ideal talaga yung narrower.
Sexier ba?
Sexier. And of course, here narrower also, and less rounded. And upturned nasal tip. Okay? So, yun ang goal natin ngayon kay Jean. Right? So, our approach, again, will be non-surgical. So, we don't wanna do any cutting. Ayaw nating maghiwa. Right, Jean? And we will just be, as much as possible, conservative. Okay? But right now, an approach will be different in a way that I will narrow the alars with the so-called alar bunching, but I will be using a different kind of thread.
Oh, wow.
Okay.
Bago.
Yes. Later on, we will show klase nung thread na yon. And I will be adding also yung tinatawag na nose meso.
Wow.
Kasi when you say mesotherapy, yun yung ini-inject natin yung mga fat-dissolving solutions. Like for example, for face meso, we inject yung mga superficial and deep fat pads nung pang-dissolve ng fats. Even sa body meso, right?
Opo, meron.
So, we'll also use right now yung tinatawag na meso injections for the nose. Kasi the nose area, especially if it's very thick, meron din siya mga fatty tissues. So, somehow we can inject yung fatty tissues dun sa nung pang-dissolve na yon. Kasi we also have the Botox, right?
Yes.
But we know the Botox is targeting mainly the muscle.
The muscle spot.
So, ito naman, we wanted to also target our fats. Ayan, so mayroon tayong bagong matututunan in today's episode. Exactly. New topic, new technique, new presentation. So, ating abangan, mga ka-CSA, sa pagbabalik ng CSA Medical Aesthetics.
Yes.
And we're back, mga ka-CSA. So, we will start with the procedure on our bridge enhancement. So, initially, you have to disinfect the area. Okay, a while ago, a topical numbing cream was applied. And then, we also did some injections of lidocaine into the dorsum and tip of the nose. So, after that, we have to make an entry point at the infratip region. And I'll be using my PDO threads for my bridge enhancement. Okay. So this is a PDO thread for the dorsum definition. So some resistance only, because Jean also has really a good nasal bridge. So high nose naman na si Jean. Okay. So that's gonna be my third PDO. Hindi na tayo nag-hyaluronic filler because as I've mentioned, high nose naman yung kay Jean. So it's more of enhancement lang with threads. And this is
5 na po.
5th. So we just wanna further narrow and give definition to our nasal bridge. And there you go. We'll put on this sterile surgical drape because the Alar bunching is a minimally invasive approach or technique. There you go. You can cover a bit the mouth region. Okay. So a while ago we did anesthetize. Can I have a sterile OS, please? I'll cover the eye area. And puncture point. Okay. So for Alar bunching or the narrowing of the alars, we will be making use of a double spear type of PDO threads. Okay. So a while ago I did an injection of local anesthesia, our lidocaine, and we will be making an entry point on the alar groove right side first, and another entry point on the left alar groove. So we have here our double spear. Okay, there you go. So we mentioned that it is a double needle or a double spear type of our PDO cog thread here. Okay, so I'll have Dr. Nina hold the other needle, and our first entry point will be the right alar groove. So we already made a puncture, an entry point, and vertically insert the tip, and we'll thread this towards the opposite alar. So we'll just pull the entire needle. So the idea here is for bunching to happen. So we can actually do a further pulling. Okay. Now the same entry point that I entered a while ago, I'll repeat the same technique. Ngayon bunch again. So reverse entry, opposite side, we'll bunch, we'll pull the needle, towards this side here. There you go. So we'll just pull this like that, and then we can cut dito doc. Yes. So with this type of technique, entry point, exit point, and then on this exit point you re-enter towards the opposite end, and then we can just bunch like that. There you go. And we'll make a knot. So I'll just tie this. Suture. Hold this one for me, please. Thank you. So since we're using a cog thread, so if somehow the cog or the barb was able to hold on into those tissues, and then we'll just cut the remaining barb thread. Okay. So after doing our Alar bunching using the double spear type of thread, now we'll be doing the tip Columella projection. So a while ago we mentioned that we wanted to upturn the nasal tip and show the columella as well. So we'll just make another entry point here, and I'll be using a PDO thread, gauge 19 with 38mm length of the needle, or rather the cannula. So I'll pinch the columella here and insert our PDO thread there. And more of our 1938 or gauge 19 38mm length of cannula for our nasal. Okay, and finally, for our last procedure, we will use this meso solution to target the nose fat tissues. Okay, so I'll open the box here, and it has 5 vials. So I'll get the 1 vial there, and then we'll just aspirate 1 cc, and we'll use this 1 cc syringe to inject into those nasal fatty tissues. Okay, like for the alars or the sides of the nose, the tip of the nose, or even the sides of the nasal bridge. So I'll just need a gauge 30 needle. Okay, so we'll be injecting first into the tip region, nasal tip. Okay, nasal tip. So I'm using just a 1 cc, so supra tip. The goal is to make the fatty tissue lesser or decrease the thickness of the fats, right? And then here, so injecting this solution, here. So still numb because of those local anesthesia that we injected a while ago. And injecting here, injecting there. And usually the result of this one, we wait for about 2 to 3 weeks for this meso solution to take effect. So the areas where we can see some fatty tissues, so we wanted this rounded tip to become slimmer. Okay, we'll add more. So I use 1 cc, 1 more here. So we are done with the nose procedure for Miss Jean. So we'll be looking at the result when CSA Medical Aesthetics returns. And we're back mga ka-CSA. So we will now show the result to Jean. Okay, ipakita po natin yung pagbabago, yung pag-narrow noong alars or the wings of the nose using our double spear PDO thread with the so-called Alar bunching method. Okay, so let's show the mirror.
Here's the magic mirror.
Yan. So, noticeable yung dito, yung pag-narrow. Kanina, we measured it.
Yes.
It was 45 millimeters. Now, Jean, mineasure natin ulit. It became
38
millimeters na.
Yes,
so, there was 7
na nabawasan.
Reduction doon sa width. Now, yung alar and nasal tip are still rounded kasi we injected yung meso fat dissolved solution.
Yes.
So, syempre, pumasok yung gamot, medyo nag-engorge muna yung tip ng nose.
Opo.
So, we will do a follow-up ng 2 weeks
Opo.
to see yung reduction pa ng mga fatty tissues dun sa tip and the alars. So, the good thing right now, yung instant na nakita natin is the narrowing.
Opo.
So, nag-reduce
There's
yung
instant
width.
narrowing po. Opo,
Exactly.
ala. 7 na po yung
Right,
nabawasan.
yeah. And that will still improve over time. Tapos, yung bridge ni Jean, so, na-increase pa natin yung height.
Yes po.
Yung projection ng kanyang dorsum. So, the dorsum and the alar width,
Opo.
nag-improve. Right? Yun lang, I was telling Jean na as much as possible, avoid muna yung too much movement around the mouse. Kasi there's this thread
Opo.
na tight.
Yes.
So, i-reduce muna natin yung pagnguya niya ng mga solid or yung matitigas na pagkain. So, magso-soft diet muna
Soft diet. Lugaw.
Tamang-tama rin, nagda-diet si Jean.
Lugaw, ramen, ganon.
Exactly, yun na
Opo.
muna. And then, syempre, medyo may swelling ngayon dun
Yes.
sa nasal tip, but wait for that to subside. Some people have a faster healing 2 to
Opo.
3 days lang yung swelling nila. But I really appreciated this double spear alar bunching method. Kasi 'di ba entry point, exit point, and then nag-reverse tayo, entry, exit, and then dun sa pwedeng mag-knot ka, basta make sure lang na the thread will be inserted doon sa dun sa may puncture point. Wala dapat nakalabas na thread. Then cut it, and then we'll notice na yung pagka-bunch ng ating alars. So I like the bunching method. Now the nasal tip, yung dito at saka columella, we also inserted mga short PDO threads. Okay, we'll still assess that. Tignan natin ulit yung pag-angat and also yung columella show. Para yung columella niya nakikita.
Yes,
Okay?
Doc. So, napansin ko, Doc, it's very sexy on this part.
Yeah,
Kasi
yeah.
in-increase na.
I love it.
Opo.
And still, we wanted yung natural pa rin na they would recognize Jean.
Opo, yes.
It's not really altering yung anatomy.
Opo.
It's just
Enhancement.
enhancing what you have. Tama? Oo. Kasi Jean has a very attractive face already. Magandang mata, maganda yung shape ng mukha niya. And then, of course, si Jean will maintain skincare and then also yung mga anti-aging na rin.
Yes,
Yan.
opo.
Ilang taon na ba si Jean?
42 po.
O, see? Hindi siya mukhang 40. She looks younger.
Yes.
She
opo.
looks a lot younger. Yan. So, thank you so much, Jean. Thank you, Doctor.
Thank you din po, Doc.
Meron ka bang konting mensahe or konting masishare sa ating mga nanonood? Something lang yung sa experience mo dito
Masakit
sa...
po ba?
Kayang-kaya ba natin? Kaya naman.
Kaya na po.
Kaya, oo. Sabi nga nila, tiis ganda. Yan. Oo, no pain, no gain. Kung nakayanan ni Jean, kaya din natin to.
Yes,
right?
that's true.
Yan. Salamat, Jean.
Salamat po, Doc.
Okay, God bless you always. Stay safe palagi. Okay, ingat-ingat sa panahon na to. Doktora, thank you so much.
Thank you din po.
Any parting words?
Ayun, I have witnessed again another exceptional procedures, Doc. The cog threads and also, yun yung meso, bago yun.
That's new.
For the nose, di ba? Kasi we're injecting here the mesotherapy on the double chin lang and also with the fat pad sa tummy.
Yes.
Ngayon, tapos bago itong nasal, dun sa nasal mesotherapy. Abangan po, abangan.
Yan. Ayan.
Thank you, Doc.
So if you have any other questions, you may email us at csaskinclinic@yahoo.com. We also have our FB page, CSA Medical Aesthetics, our website, csaderm.com, and our clinic is located here at the Infinity Shop, Cluster I, Unit 1, Francisco G. Nepomuceno Avenue, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And our other videos, you can see them at our YouTube channel. Only type Contessa Salvador and please subscribe and also click on the notification bell. Okay, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.